It was just a big roller coaster. You didn't know what was coming.
2020, a year of uncertainty.
Overnight, everyone's life changed dramatically.
Perhaps no one's life changed more dramatically than healthcare workers.
We were just as scared as anybody else, but we showed up.
Each nurse with a different story, a story that still impacts them 5 years later.
The biggest challenge was the emotional toll.
The impact evolving the profession to this day, but issues still remain. In rural eastern North Carolina, Ashley Scholler faced the front lines of COVID right from the start.
I was actually the first night nurse that took care of our first COVID patient.
Scholler and millions of other nurses changing their work-to-home routine like they never imagined.
I took everything off. I had laundry sanitizer for nursing staff. That was a very hot commodity.
But the oddity of new routines paled in comparison to the gravity of what she faced in a rural ER.
We had 15 beds, and I remember one weekend I was working, we were all short-staffed, and our total number, which was the most in the hospital's history, we registered 142 patients on one day, and the next day was 144.
In Concord, Damola Ogunami started her career during COVID. She too remembers the challenges of separating work and home.
In the garage, we had this little storage area. I'd have to change in there just to make sure my family is not exposed to it.
Memories of isolation forever imprinted in their minds as patients nearing their last breath separated from family.
They felt that he would not make it out, and so I took my personal device in and let them, have a FaceTime whenever they see me. They thank you for that.
5 years later, it's the faces that stick with them more than the challenges they faced.
Just seeing them decline rapidly in days and then talking about end-of-life care.
The emotional toll heavier than physical exhaustion.
We've been talking about burnout and psychological distress and those kind of work-related concerns for years and years and years, but all of a sudden it was just the spotlight was on. How are we keeping our healthcare workers, our nurses, everyone who's in the hospital together, how are we keeping them physically safe? How are we taking care of them mentally?
It's an issue hospitals are still sorting out 5 years later. Kara Evans trains new nurses and helps further their careers with Atrium Health. She's now Dr. Evans, and her PhD dissertation focused on that very issue. Early on during COVID, healthcare workers were hailed as heroes.
And that's well intended, but it also creates this expectation that you can continue to show up every day, but not need time to rest, to eat, to be with your family.
The pandemic also ignited a desire to have a bigger voice.
Nurses need to be involved in these decisions, that are shaping the care that we give. So I wanted to make sure that 100 years from now, there was some kind of a record.
In May of 2020, Kara Evans began her doctoral program, and her dissertation honed in on 33 interviews with nurses and their experience during COVID. Something for the history books, but also a moment of learning.
We didn't know what was coming, and we didn't know how to equip ourselves. Hospitals now are really investing in employee assistance programs and having more access to, therapy for their nursing staff and other things.
It's even more vital as another concern lurks around the corner. An NC NurseCast model projects by 2033 the state will face a 27% shortfall of LPNs, licensed practical nurses. They project 11% shortfall of registered nurses. Currently about 162,000 RNs work in North Carolina, meaning the state could find itself about 12,500 nurses short. Ashley Scholler says there's not a single issue to fix the shortage, it's a number of factors.
I think pay is slowly catching up. One priority that is really near and dear to my heart is the fact that we have seen violence against nurses skyrocket. Unfortunately, we have had some North Carolina nurses suffer at the hands of patients, and they have become fatalities themselves.
The day I got to see a discharge to home, getting back to their families was really awesome.
Those happy moments help carry these healthcare workers through the tough times. Despite the exhaustion, the fear, and even the violence, these nurses came out more motivated than ever.
Being able to rise above it all with my fellow team members has just renewed my sense of purpose within nursing.
A profession focused on what they do best, caring for others, now also focused on caring for themselves as well.